Hello, and welcome to Healthy California podcast. My name is Linda Brown, and I am the host of Healthy California, where my goal is to help educate you on your daily choices so we all can become healthy. I believe you, your family, your neighbor, and your community are all looking for better ways and simple ways to return to being healthy. Many of you have health issues or have family that's going through tough times that seemingly have no answers. It's frustrating. There are questions about health, environment, foods, exercise, and lifestyle, and it can be all overwhelming. And who do you believe? And where's the science behind it? This podcast will unravel the mystery behind being unhealthy and talk about little things that we can do in our lives to make a positive change in our health from all angles. So to be healthy, we need to have physical health, mental health, environmental health, financial and social health, and of course, spiritual health. Let's answer some of these questions to get healthy. What good is just listening to a podcast? I will give you resources as well, ways to take steps and make positive changes in your life to becoming healthy. This is a journey, not an assignment, so be kind to yourself. Okay, California, this is Linda Brown. Thank you for joining me here at Healthy California. Today we are talking about constipation. Yes, we are talking about poop. So the reason why I chose to talk about this is because constipation is a big determiner of your health. And there are so many people constipated. Actually, it's the number one GI complaint in the US is constipation. You know, poop is not supposed to be in our body. Our body is meant to take what we eat, absorb from it, digest it, and then get rid of what we don't need. So what comes out of our body is not supposed to be there. We're eliminating it for a reason. And it has toxins in it. It has sludge, and if they're not eliminated, they can some of the toxins can get reabsorbed and stored into our body. So stored a lot of times is stored in our fat. So if we have a lot of toxins and not a lot of fat, our liver is going to create more fat so that we can store these toxins. So a lot of times people will have a lot of weight on them because they have a lot of toxins in their body. So we end up gaining weight. And so when we gain weight, we can store more toxins, but also when we gain weight, it sets us up for more disease processes that come along with gaining weight. So, stool just sits there. It's a greater determiner of colon cancer than genetics. So if you think about sludge just sitting in your body, that's supposed to be gone, that toxin is just sitting there. So yeah, being constipated is a bigger determiner of colon cancer than just genetics. So that's why we're talking about that today. What is constipation? Constipation is defined typically as decreased bowel movements, so you're having less than 3 bowel movements a week. And if you're straining more than 25% of your bowel movements, if you're straining, that would be considered constipation. If you feel like you have an obstruction or a blockage in more than 25% of your bowel movements, that would be considered constipation. Or if you have hard pellet-like stools, that would also be considered constipation. So there's this Bristol stool chart that you can look to see what like a healthy bowel movement should look like. And it's in my show notes, or you can just Google Bristol stool chart, Bristol. So people that are constipated will often complain of bloating, abdominal discomfort, which, of course that makes sense, because if you can't pass your bowel movements, it's just going to keep building and building and building. And for the reasons of the constipation might be causing bloating as well. Not just the constipation itself, but the reason for the constipation could cause bloating. And the disease starts in the gut. It starts in your colon. So disease starts in your gut. It starts in your colon. So that's why we have to keep our gut healthy. And it is the most common digestive complaint in the US. That's why we're talking about it. Like I said, poop is not supposed to be in our body. So our body has a detox system. And I talked about this a little bit last week. Our two main filters are our liver and our kidneys. And, our cells itself have a way to clean up the cell. But we're talking about the liver and the kidneys. The liver eliminates waste and it eliminates it into our intestines so that we can defecate it out. We can get rid of it. In order for the liver to do that, the liver needs to be healthy. So if we have a toxic burden, I talked about that last week. If we have a toxic burden, the liver is not going to be healthy. So we also need to put healthy things into our body so that we can have a healthy liver so that the liver can do what it needs to do. and that's elimination. Filter and elimination, and many, many things that the liver does. And then we have our kidneys. So our kidneys also eliminate waste, but it eliminates it through our urine. We need to have healthy kidneys as well. But we're talking about constipation, so we need to move it through. And then there's 4 ways to eliminate the things from our body, and that's through our skin, our breath, our urine, and our poop. So skin, obviously, we have sweat, but if you have eaten garlic, you can smell that on your skin the next day. If you have eaten cabbage, sometimes people have that smell after cabbage because we're eliminating things through our skin. Breath, we do breathalyzer tests. So yeah, we eliminate things through our breath, and of course our urine and our bowel movements. So today we're talking about our poop. And if toxins aren't eliminated, they get reabsorbed. They can get, not always, they can get reabsorbed. Because if you think about it, we have these toxins in our body that is supposed to just move through, right? Are you going to touch poop with your hands? No, of course not. That's disgusting. So if you're not going to touch it with our hands actually have a more protective skin on them than the mucosa in our colon and in our intestines. So if we're not going to touch it with our hands, why would we allow it to just sit there, this toxic sludge? Why would we allow it to just sit there? We shouldn't. It's toxic. So, we need to be pooping as many times a day as we're eating. So if you have 3 meals a day, you should be pooping 3 times a day. What is the average American poop? Americans poop less than 1 time a day. If we're eating 3 times a day, but we're pooping less than 1 time a day, that's a problem. And the doctors won't even consider you having constipation until you've gone 3 days without a bowel movement. And that's obviously to me, that sounds troublesome. Every now and then, if you had a bad meal, maybe let's say you ate a lot of cheese and you're backed up. That's not what I'm talking about. I'm talking about when you have chronic constipation. You shouldn't be on any sort of chronic medications for constipation. Any sort of medications that you're on is only supposed to be used temporarily. So we got to figure this out. We end up gaining weight, we store more toxins, it becomes this vicious cycle. If stool just sits there, it's a greater determiner of colon cancer than genetics. And that makes sense now, right? Because you have sludge just sitting there, and then we keep eating and it just builds up and builds up and builds up. And then we start developing these little bulges because this constipation is backing up. That's the diverticulosis that we develop from having constipation, having our bowel movements just sit there, and not only just sitting there, but sitting there and being toxic. So that's just something to think about. So what are the risk factors for constipation? What is it that is going to give you an increased chance of having constipation? Age. At a certain age, things just kind of slow down in general. So I'm not saying that just because you might be a little bit more advanced in age that you're automatically going to have constipation. That is absolutely not true. But there is a thing that at a certain age, everyone just talks about their poop, right? And that I'm getting to that point where, we get around the dinner table and we just talk about our bowel movements. I'm kidding about that. Or am I? So anyways, it's funny to talk about, but age can be a risk factor for constipation. Education on constipation, on bowel movements is important as well, because we don't talk to our doctors about poop unless it's already a problem. We don't talk about it in general. We just don't talk about our bowel movements. The education on if you have to go to the bathroom, you should just go. Don't hold it. Don't be, a lot of us have, shy bowels, shy bladders, and we don't like to go number 2 in a public restroom. But, if that's the case, then you got to eliminate as soon as you can, because it's not healthy to hold it. So that's what I mean by education on health and bowel movements. So after this podcast, consider yourself formally educated on why constipation is not good. Another risk factor for constipation is physical inactivity or prolonged bed rest. So I'm not just saying physical inactivity because I'm a physical therapist. I'm saying physical inactivity because that seems to be a cause for so many different disease processes. If you go to any organization that, the American Heart Association, the American Diabetes Association, all these big organizations, the number one thing, not the number one, but one of the main things for preventing or for treatment is physical activity. It's so important to move. Our body was meant to move, so we need to move. And I'm going to have a physical therapist on here at the end of this, and she's going to talk about movement as well. Give us little tricks on what we can do for constipation. So another risk factor for constipation would be poor gut microbiome. So, people are always talking about their microbiome. If you have poor gut microbiome, that's a risk factor for constipation. Things, again, aren't healthy and aren't moving. If you have food sensitivities, or you don't even know you have food sensitivities, that could lead to constipation as well. Certain medications, the non-steroidal anti-inflammatories, the pain meds, can cause constipation. Anesthetics, antacids. Sometimes we take antacids to help our stomach. And I want to take a second to share a helpful resource with you. I have a free health questionnaire designed to pinpoint the areas in your life that you need to focus on for optimal wellness. If you're interested, simply click the link in the show notes or visit heal-throughfood.com to access it. Now let's dive back into the show. Chronic use of that could lead to constipation. Depression can lead to constipation. Abuse, physical or sexual abuse, can lead to constipation because that's stress, right? And stress can lead to constipation. So think about stress for just 1 second. If you are under stress or have had a lot of stress in your life currently or in the past, think about stress as running from a tiger. If you are running from a tiger, constantly running from a tiger, because it's a protective mechanism, then the last thing your body wants to do is digest things, because that's low on the totem pole of priorities. If you're running from a tiger, you're trying to survive. You're not trying to poop. So if you're in a constant state of stress, your GI tract, your bowel movements are going to be depressed. Low fiber diet is also a risk factor for constipation. Low fiber diet. So when you think about fiber, people say, well, if you eat a lot of fiber, you're going to bulk up your stool and it's going to pass. Yes, that's true. That's absolutely true. But fiber in general, the foods that you get fiber from have so many nutrients, and your gut microbiome needs that fiber to be healthy. So if you take fiber in the form of Metamucil, you're not going to be getting the same nutrients from that fiber by just taking Metamucil. I'm not saying Metamucil is bad. I'm just saying if you can get your fiber from a good, healthy source, that is ideal. Because if you eat a lot of fiber in the form of vegetables, then you're actually getting a better microbiome. You're kind of hitting two birds with one stone at that point. I don't think that's politically correct to say that anymore. Let's see. Dehydration. Dehydration is a big risk factor for constipation, and we should be drinking half our body weight in ounces, and throw some electrolytes in there. Damage to your pelvic floor musculature is also a risk factor for constipation. Damage to your pelvic floor muscles. Trauma, passing a baby through your pelvic floor, I'd say that's traumatic to your pelvic floor musculature. I also had a patient a few years ago. She had fractured her pelvis in multiple places because she was a paratrooper. She would fall out of this plane. Well, she would jump out of this plane with a 40-pound pack or a 60-pound pack. I don't remember. Either way, she would, and then of course she would land, and then she would have to hike 6 miles or however it was. And she did that with a broken pelvis. That's traumatic, of course. Anything could weaken or damage your pelvic floor musculature. And at that point, you would need to talk to a specialist on that, which I'm going to have coming up, a physical therapist. Hormonal changes can lead to constipation. Genetic predisposition. So when I say genetic predisposition, there are some genetics involved in constipation, but I don't want you to think my mom or dad had constipation, so I'm going to have constipation. That's absolutely not true. It's more, there's some genetic predisposition, but it's more of a lifestyle factor that causes constipation. Like I said earlier, if you If you have a family history of colon cancer, it's absolutely important that you get your colonoscopies, but it's also more important to make sure that you don't have chronic constipation. Just because you have a genetic predisposition doesn't automatically mean that you're going to have constipation. Another risk factor would be decreased gut motility or colon motility. That just means decreased ability to move those muscles and push things through. Hypothyroidism would cause that. Decreased motility, just not moving could cause that. There's a few different reasons why you would have decreased gut motility. And then, of course, what I talked about last week as well, exposure to toxins. So there's a lot of different reasons, and there's probably more reasons, but these are some of the main reasons people have constipation. So I'll go through it again. Increased age, education on constipation, physical inactivity, poor gut microbiome, certain medications, depression, physical or sexual abuse, stress, low fiber, dehydration, damage to pelvic floor musculature, hormonal changes, genetic predisposition, decreased gut motility, toxins, hypothyroidism. And I just want to emphasize that constipation is not a disease. It's a symptom. It's a symptom of a disease, and or it could lead to disease. So don't think of constipation as a disease. So what kind of impact does this have on you? So constipation, could lead to diverticulitis, diverticulosis. I mean, that's that pouching, bulging in your gut, in your colon, because of weakness. But if you think about sludge just sitting there, toxic sludge just sitting there, of course it's going to start bulging out. So this could lead to diverticulitis, diverticulosis. IBS, IBD, Crohn's disease, that's more of a cause of constipation, but the treatment's still going to be the same. Could still be the same. Chronic inflammation in the body. So if you have constipation, it could lead to chronic inflammation. And we're talking about inflammation that you're not going to feel. Autoimmune disorders are chronic inflammation. Cardiovascular disease is chronic inflammation. So we're talking about inflammation next week. So stay tuned for that. Constipation could also cause decreased energy, because again, if your body's trying to heal, it's trying to detox, it's taking away energy stores from you. You have a decreased ability to heal from sickness or injury or stress. Weight gain, you can gain weight by being chronically constipated. And then all the diseases that come along with increased weight gain. So if you have increased weight gain, you're more prone to have pain, you're more prone to have other diseases, you're more prone to diabetes, inflammation, hormonal changes because of the estrogen that adipose tissue or the fat is releasing. So having extra weight on your body is leading you towards other diseases. So constipation leads to weight gain, which leads to other things. And then, of course, we get our colonoscopies. We are doing that because we're trying to prevent cancers. So constipation can lead to cancers, and I say cancers plural because it's not just colon cancer. Colon cancer, of course, because the constipation is there in your colon, so you have this toxicity there, and it makes it more prone to have cancer there. However, if you have constipation and it leads to a chronic inflammatory disease, then if you had one cancer cell in your body, think about this. If you have one cancer cell in your body can fight it off. No problem. We're exposed to things all the time. But if you had one cancer cell in your body and your body is prioritizing inflammation, it's prioritizing the fact that it has an autoimmune disorder, it's prioritizing the fact that it doesn't have the nutrients it needs to heal, it has hormonal changes, it has all these toxic burdens it's trying to deal with, it might not catch that cancer cell or it might not prioritize it. So that's what can lead to cancer, is the fact that you have a body that's trying to do so many different things. And I'm just generalizing this. I'm not saying all cancers are like this, because cancer is a very involved diagnosis. But why not give your body what it needs to heal the things that it's exposed to, cancers or viruses that come along once every millennia and wipes us out? Why not put your body in the best health that it can be to fight things off? The body was meant to heal itself. The body wants to heal itself. Even in the Bible, Proverbs 3:8 says it will be healing to your flesh and refreshment to your bones. The body wants to heal itself. So it's like constipation. Is it the cause of something or is it the effect of something? It could be both. Either way, you got to get rid of it. You got to move things along. So then what can we do? All the things that I had mentioned earlier, all the risk factors, so we can eat a lot of fiber. And when we can eat a lot of fiber in the form of colorful fruits and vegetables. Fruits and vegetables. Don't be afraid of fruits. A lot of fruits, colorful fruits and vegetables. Fiber absorbs water. We already know that. It bulks up the stool. But more importantly, it's good for your gut microbiome. That's the more important part. Our gut microbiome needs that fiber. And along with that fiber comes all sorts of nutrients that make your body healthy. You can decrease your toxic burden. We talked about that last week. Eat clean foods. Go look up the Dirty Dozen or Clean 15. We can drink plenty of water. Half your body weight in ounces. So if you weigh 200 pounds, half of that would be 100. So 100 ounces. Add some electrolytes to that. So what else can we do? Be active. Like I said before, and I'm not saying this because I'm a physical therapist, but the body was meant to move. And even the therapist that's coming on here in just a minute, she's going to say the same thing. The bowels, if you're not moving, your blood's not pumping, your lymph system is not pumping, and your bowels aren't moving. So you gotta move. You need to get plenty of sleep, because if you're constantly running from a tiger, you're not healing, and your body needs to be more in a rest and digest. So get plenty of sleep. Decrease your stress. Meditate. Pray. Track or journal your progress. And when you track or journal your progress, you become more fine-tuned to your body. If you don't know that you're constipated, or you don't know, I ate some cheese last night, I'm going to be constipated tomorrow. Those are the types of things that you should know about yourself. I'm going to eat this. I'm going to pay for it. Is it worth it? Probably not. Is it worth it? It might be worth it. But you need to know, you need to start paying attention, because your body will tell you things. A lot of times we get a disease, and we think it just comes out of nowhere. Like I just all of a sudden woke up and I had this, I had diabetes just like that. Probably your body was telling you something for a long time, and either you were choosing to not know the symptoms or you just weren't fine-tuned enough. So now is a good time to just be fine-tuning your body, really listening to what it's telling you. It's telling you a lot, actually. What else can we do for constipation? Physical therapy, learn how the muscles are supposed to work. Your pelvic floor, it's a bowl of different muscles. And those muscles can, like any muscles, it can be weak, it could be tight, it could be out of balance. So we'll see what this physical therapist has to say. What else can we do for constipation? Supplements, magnesium, vitamin C, prebiotics, postbiotics. We can take laxatives, we can take stool softeners, but I want to emphasize laxative and stool softeners are not intended to be used long term. If you've been on long-term stool softeners, that is a problem, because you're just solving the problem, but you're not solving the root cause. Like, what is causing you to be constipated? That the cause of that is still there, and it's leading you down a road process to disease. So if you're on chronic or constant laxatives or stool softeners, now's the time to start making some changes to get off of those. I don't want you to go cold turkey off of them, because then you're gonna hate me. It's not gonna be comfortable. But start working your way towards having a healthy gut and healthy bowel movements. And if you're on diuretics, increasing water might not be an option for you, but making your gut healthy is still possible. So you can still have a healthy gut that can lead to healthy bowel movements if increasing your water intake is not an option. Let's see what else we can do through the form of physical therapy. So I'm going to have Molly on here because she is a good friend. We were classmates together a million years ago, and she is who I would send all of my patients to, or anyone who calls about pelvic health. And it's not just constipation. She doesn't just work on constipation, but she's the person that I would go to for any pelvic health issues. So today I have with me Molly Tenhoko. Molly and I go back many years. We were in school together. Today, since we're talking about constipation, anything pelvic floor, Molly is the person I would go to. So thank you for joining me, Molly.
Thank you. I'm happy to be here. Thanks, Linda.
Before we kind of dive into poop or lack of it, why don't you tell California a little bit about yourself and what made you become a pelvic floor therapist?
So I'm Molly Tianhoko, and I own Milestone Physical Therapy in Roseville, California, and have been working on this for about 12 years or so now. We're trying to do things a little bit different because pelvic health is a little bit different and doesn't always fit easily into the physical therapy model we have right now. So I don't know if you remember when we were in PT school, we had 1 week and pelvic health, and it was women's health. We didn't even talk about men's pelvic floors. And I was front of the class because I actually didn't know it existed. I was going to physical therapy school for sports medicine and orthopedics, and I was so impressed with the information. And we just have more and more and more information now. But pelvic floors can get tight, pelvic floors can get weak. And I had had a tight pelvic floor my whole life, and I knew nothing about it. So I was so excited to get that information in PT school. And I knew that week that's what I wanted to do. Took me a little while because you have to do some extra training and,
Yeah.
kind of navigated through all that. But yeah, that's where I first learned about it and why I want to do it. My heart goes out to patients who just don't know about their bodies. We don't talk enough about how the pelvic floor works and our bowel and bladder function and all of that. So I'm happy to be the person to share that with them.
Well, today we're talking about constipation, but there's so much
Yes.
more to pelvic health. What would you tell someone who says, "Well, I don't have a pelvic floor. I'm not a female."
I love that one. We get
Why
it
would
all
you?
the time. That's just for women. No, men have pelvic floors too. Men get constipated just like women, and there can be a pelvic floor component to that. Everyone has a pelvic floor. We work with kids sometimes on connecting with that part of their body and helping with constipation and tummy troubles and things that they have. Men, especially, we get to see them after prostate cancer. Sometimes they'll have removal of the prostate and then have incontinence or pain. And so we get to see them at that point, and they have never heard of us. And so they're a little apprehensive, but it's such an effective treatment. And it's really mostly about being aware of your body and how it functions. And once you understand that, things can work much better. So everyone has a pelvic floor. We work with men, women, everybody.
What is a pelvic floor?
Yeah,
When
so
someone says, "I don't know what that means. I can't even picture what you're talking about." Maybe you can define it and let us know what is the pelvic floor?
it's a great question. I mean, we could simply say it's a diaphragm. It's a layers of muscle down in the bottom of your pelvis and when I say it's a diaphragm, it sort of reflects your respiratory diaphragm on the top. We have this diaphragm like a dome up under our rib cage that drops when we inhale, lifts when we exhale. And the pelvic floor is a diaphragm as well. So when we take a breath in and our respiratory diaphragm drops, our pelvic floor should drop. And when we blow out and our respiratory diaphragm lifts, our pelvic floor should lift. So they work together almost like a piston in a car, pumping up and down. And so because of that, there's so much more function that a pelvic floor can do, like moving fluids and supporting digestion and all of those things, just because of that pumping action. But because it's a diaphragm, it holds our organs. So you could also think of it in the base of your pelvis like a little fruit bowl. And the fruit are your organs, your bladder, your bowels. If you have a uterus, your small intestines, you think of that as the fruit inside that fruit bowl. And when you're very relaxed in your pelvic floor, that fruit bowl is deep. And when you contract, that fruit bowl lifts up like a plate in your pelvis and helps support your organs. So has a supportive function. It has what we call a sphincteric function. So it holds back our urine, our gas, our poop with a little squeezing maneuver. So the layer on the outside is a squeezing layer. It has little, you kind of picture a figure eight wrapping around the urethra in the front, the rectum in the back. If you have a vagina, it wraps around the urethra and the vagina in the front and the rectum in the back. And that figure eight closes down to close off those openings to hold back urine, bowel gas. And then the layer deeper than that, you can almost think of like a lasso that wraps around these tubes, right? Your urethra, your rectum, vagina, if you have one, and it pulls back and creates angle to those tubes. So just like putting a kink in a hose, it's hard to get the water out if you've got a kink in the hose. Those muscles create that function for us to keep us continent.
That's a lot.
It's a lot. It is so much.
Yeah. So
Yeah.
when I used to teach anatomy and physiology, I would tell, I mean, this was anatomy and physiology one, so the basics. So what I would tell my students on a very basic level was if you didn't have a pelvic floor, just that muscle bowl, if you didn't have that, your guts would fall out between your legs. There's nothing and so that's a very gross, basic way to explain it. But I love your explanation. Obviously, you're the expert, and I've already just learned a lot just in the last few minutes. So that's great.
Yours paints a picture too. I love that. Yep. It just, everything would fall right out.
It
We
just
need
fall
that
right out.
pelvic floor.
Who would be coming to see you? What kind of what kind of
Um,
symptoms would someone have that would make them go seek out a pelvic floor therapist? Who are those patients that are seeking you out?
Yeah. So patients who are dealing with bladder issues like incontinence or urgency, sometimes the opposite of that is not being able to start a stream. That can be kind of distressing. Bowel dysfunction, so constipation, hemorrhoids, anal fissures, all sorts of things that can happen there. Prolapse. So if we don't have a strong pelvic floor, there's fascial weakness in it. We can get a distension, kind of a dropping of those organs, and that would be prolapse. And constipation. But it's funny, that's usually a side thing. And honestly, sometimes incontinence is a side thing. They come in for back pain and, it just comes up that, oh, I gotta go. I have to go all the time. Or, or oh, I'm a little constipated today. And we dig a little more into to that and find that it's a chronic issue. Sometimes they don't know they can't come in for pelvic health concerns. Nobody's referred them for it. They don't know about it. It's just a incidental finding during their review of their medical history or conversation. The other would be pelvic pain. We see quite a bit of pelvic pain. So pain with intercourse, pain with sitting, cycling conditions, that sort of thing.
Yeah. I have known a few people that have told me that they've had, chronic back pain, and they went to a pelvic floor therapist for something completely different, and it ended up fixing their low back pain that no one else could. And if you think
Yes.
about it, the pelvic floor is attached to all the, or indirectly maybe through fascia, to a lot of the muscles in the back or to the core. And I know when I used to teach Pilates, we worked on the pelvic bowl, low abs, just the whole core. When we talked about the core, we always talked about the pelvic bowl. So same
Yes.
thing. So yeah, so people that have back pain could probably benefit from pelvic floor therapy.
Most definitely. So, two good examples, back pain, hip pain. If it's not getting better with traditional physical therapy, when we're working with the pelvic floor, we're looking for a nice neutral position of your pelvis to help the muscles be in a relaxed state. If our pelvis is tipped forward quite a bit, maybe the back of our pelvic floor is sort of stretched out and lengthened and the front is kind of tight. Maybe we're the opposite. Maybe we're really tucked under and kind of gripping in the back, which could be something that leads to constipation. And so we're really looking for this neutral pelvic alignment to help the muscles of the pelvic floor operate at their best. And when we do that, that has so much to do with the back alignment that sometimes we see improvement of the back pain when we're trying to work with pelvic floor. Also with the hips, the stubborn hip pain that maybe isn't improving. When you come to see a pelvic health physical therapist, the gold standard of evaluation would include an internal exam. It's not necessary. If you're not comfortable, that's okay. We have lots of tricks up our sleeve, but when we do an internal exam, we can feel the muscles of the pelvic floor, but we can also feel the muscles of the pelvic wall, which are hip rotators. So your obturator muscles sit up inside there and they rotate the hips. So sometimes we're doing an exam and that obturator is tight. And once we start doing trigger point release, the little manual therapy to that tight muscle internally, the hip no longer has this pulling tension. It frees it up and the hip pain can improve. So I'm just always amazed, when things we've always treated as, strictly orthopedic, we add a little dash of pelvic health to it and it can make a lot of difference.
Yeah, that's great. So tell me what you would do for someone who has constipation. I'm sure that people don't, not everyone goes to you strictly for constipation, but it might be something that you reveal in an evaluation and they didn't know they could see you. But for someone who has constipation, what would you do for them?
Right. So lots of reasons for constipation. So we do a little bit of a deep dive into maybe what the contributing factors are. And right out of the gate, I will tell patients that it's almost always twofold. I'm working on the muscles, the outside. We can teach a colon massage, all these things to help from the outside. But that if concurrently they could please also work with a nutritionist or someone who can help with what the makeup of the stool, right? Making sure that what we're putting in our bodies is creating a stool that is soft but not too soft, firm but not too firm, so that we can pass it more normally. So I love when we can work as a team. But for my part, we're looking for, are the muscles of the pelvic floor opening and relaxing enough to let that stool pass? And reasons that it might not be are maybe there was an injury. Maybe there's a little bit of a scar tissue that's just not allowing the flexibility of that pelvic floor to open enough. Maybe it's alignment. Maybe that pelvis is rotated in such a way that you're really tight on one side of your pelvic floor. And it's just making it really hard to relax and let stool pass. So we're working on the mechanical things first to make sure we're really in good alignment for optimal mechanics. And then it's coordination. Sometimes we have something we call dyssynergia, where we go to give a little push and the muscles are tightening instead of relaxing. Or we say, squeeze your pelvic floor. We call that a Kegel, right? You contract your pelvic floor and they push instead of squeeze. So something in the brain over the years has flipped where there's not enough awareness of this muscle to squeeze when we say contract and relax when we say relax. It's backwards. So we'll use biofeedback and training to help retrain that old habit so that when they are trying to pass stool, they can actually relax and open the muscle so that things can pass more easily. So biofeedback is huge, and there's lots and lots of ways we can do biofeedback. So we have lots of ways that we can do biofeedback. It's EMG is one of the ways that we can look at this, and it's electromyograph. And so we use a little sensor that reads your electrical signals. And so when you're squeezing and there's electrical activity in the muscle, we see that go up on the graph. And when you're relaxing and sending less electrical signal, we see that come down. And so that's a great way to retrain muscles that have a hard time letting go and relaxing. We also have a ultrasound, a rehabilitative ultrasound imaging where we can see the pelvic floor on ultrasound and they can actually see it contracting and relaxing. And they can see that angle opening up to allow the poop to pass. So that can be really, really helpful too.
So, if someone was looking for a pelvic floor therapist for whatever reason, what should they be looking for in a therapist? Like if they can't get to you because they're in a different part of California, what should they be looking for?
Well, you want to look for a pelvic health physical therapist with some good training. I would say one of the questions is, do you do an internal exam? Because there's a trend right now, which isn't horrible, that a lot of people are offering pelvic health, women's health, but not doing any internal assessment or work, which again can be very helpful for some people. And a lot of people maybe don't want that internal work and can get a lot of progress without it, and that's fine. But if you've kind of been through everything and you really need a thorough kind of gold standard assessment, that's a good question to ask. Do you do internal assessment? And that can be done vaginally or rectally. And again, even if someone does that, it doesn't mean that you have to, but they have that knowledge that I think is really crucial, and can work from a lot of different angles. So yeah, a physical therapist, you'll see after their name PT, MPT, DPT, just based on their schooling. But beyond that, a pelvic health designation.
Okay, so what does that, can any therapist just call themselves a pelvic health therapist, or is there a designation or something that they need to be asking and looking for a therapist?
Yeah, it's interesting. There are certifications and specializations that people can have, and it will show that they are very well rounded. They've had the breadth of education that these programs offer. In all honesty, there are so many courses to be taken in pelvic health that you can have a wonderful pelvic health physical therapist that has taken, this course and that course and this course and that course, but hasn't completed a certification yet. And there's lots of really well trained and good physical therapists that don't necessarily have that specialization just yet. They may be working toward it. And I think that's just fine.
So, how would someone find you?
Yeah, so we have a website, www.milestonewellness.org. And we're in Roseville, California. We also do some telehealth as needed if someone needs a consultation and they're not necessarily nearby. Of course, I love when you can see someone in person, and I've helped many people find a therapist in their area. So happy to do that too. You can also go to the APTA's website. They have a section on pelvic health, and they have a find a provider page there as well. So you can go online and do a good search.
Just to let people out there know that if you contact Molly or anyone for that reason for telehealth, we are licensed in California. So if you're outside of California, we can't do our PT job outside of California, even through telehealth. So, all right. So if you wanted to leave one last tidbit of information for someone out there, something that you forgot to mention or that everyone should know, or an exercise or something, one last tidbit of information could you give us?
Oh, so many to choose from, Linda. Okay. I want everyone to know about the ILU massage for your colon to help with that gut motility. So your large intestine runs in a clockwise direction and it exits on the left lower abdomen into the rectum. It's a little sigmoid colon on that left lower abdomen that goes down and exits.
And it's right by that bone, right? That pelvic bone.
Yeah, right. Yeah. So your pelvic bone there, it's right deep inside there. So the ILU massage, you basically start on your left hand side at your rib cage and gently massage downward inside that pelvis, right inside that pelvic bone. And you can stripe gently down. You don't have to use a lot of force, about 3 times or so. And then you cover that space from the rib cage down to the pelvis with little circles. You're just massaging in little tennis ball size circles down that left side. So that's the I. You're tracing an I from the ribs to the pelvis. And then a U, I'm sorry, the L, IL, the L goes across from the right rib cage, just underneath, like you're kind of massaging your diaphragm up underneath the rib cage. You pull across under the ribs to the left, and then head down that descending colon and the left side. So the I that we just drew is now part of the L. So we go L across under the rib cage and down on the left side. And then we do the same thing, little circles over that pass, draw over that L in the clockwise direction. Then we do the U, where we start on the right side, right inside the pelvis. We pull up to the rib cage, across under the rib cage, and down on the left side. So we're drawing again from the right, up the ascending colon, across the transverse colon, and down the descending colon on the left side.
Everything always ends on the left side.
Everything always ends on the left side, and everything always goes clockwise. If you had a little clock resting on your stomach and you could see the hands of the clock, that's the direction your bowels run, the large intestines. So then you can just cover that whole area with nice big clockwise circles. Sometimes this is really nice to do when you're sitting on the toilet. Preferably you're sitting with your knees higher than your hips. Those little squatty potties can work really well. This little bit of massage, a little bit of rotation can really help relax you and help things kind of jumpstart the movement.
That was I was doing that while you were explaining it, and I could see how that would really work. That's
lovely.
A great little bit of a secret there that I did not know. And so thank you so much for that.
You're welcome.
So Molly, it was so great catching up with you. It was so great picking your brain. It was great having you just give us so much information that California didn't know. I didn't know. I'm a physical therapist like you, and I learned so much. So thank you so much for taking your time with us.
Yes, you too. Thank you for having me. It's really a joy. Thanks for spreading the pelvic health word.
Thank you for listening to Healthy California. I hope you learned something today. Treatment and health care should be proactive and preventative, so getting to the root cause of a disease or illness is so important. The U.S. has a good trauma medicine design, which means you see a doctor when there is already a problem. Let's beat disease before it happens. This podcast represents my opinions based on my research and education and is not intended to be used for medical diagnosis or treatment. It is not a substitute for your doctor or any healthcare provider. I provide education only. If you are looking for more answers or have questions, you can find my contact information in the show notes, or find a functional nutritionist or functional medicine practitioner to add to your healthcare team. In order for me to continue providing this free information, I depend on you to follow, subscribe, like, tell your family and friends about this podcast. Make sure you set your notifications to let you know when a new podcast is published. In addition, I can't do anything without my sponsors who I have personally vetted and highly recommend. I would never have a sponsor that I don't agree with or wouldn't use personally. I want you to gather as much information as possible in order to take back your health. You can do it, and I want to help you get there.